I'm Dr. Trish, a doctor from Page Hall Medical Centre. Thanks for watching this short video about vitamin D and calcium. You've been asked to watch this video as blood tests have shown that you have a low level of vitamin D. This video will explain what this means and why this matters, what you can do about it now and how you can prevent it happening again in the future.
So what does having low vitamin D mean and why does it matter? Vitamin D and calcium work together in our bodies to give us healthy bones. Most vitamin D comes from the sun and most calcium comes from the food we eat. Not getting much sun on your skin and not having enough food containing calcium makes it difficult for our bodies to keep our bones healthy.
When you have low levels of vitamin D, you can get aching bones and weak muscles, particularly in your back and your legs. And if your calcium and vitamin D are low, it's more likely that you'll break a bone if you fall over or get injured. The good news is, though, that it's easy to improve your levels of vitamin D and calcium, and it's something you can do yourself.
What can you do now about having low vitamin D? A normal level of vitamin D is above 50. If your vitamin D level is abnormal, it will be below this level. You can think of it like a traffic light. Green is normal, above 50, and then when it is abnormal with a level under 50, it is either orange, low, or red, very low. Orange vitamin D is low, with a level between 25 and 50. Red vitamin D is very low, with a level between 0 and 25. These two orange and red groups both have abnormal vitamin D, but they are treated differently. If you are in the orange group, you have a low level of vitamin D and you will not be prescribed medication by the doctor, but you do need to take vitamin D tablets every day that you buy from the chemist, pharmacy or supermarket. Costs will vary, but they can be as cheap as 50p per month. The red group has very low level of vitamin D. If you are in this group, you will be prescribed tablets by your GP to take once a week for 7 weeks to boost your vitamin levels. These tablets contain a very high level of vitamin D. After these tablets finish, you need to continue taking vitamin D tablets every day that are at a lower dose, but you need to buy these over the counter like the orange group. Which tablet should I buy from the pharmacy or supermarket?
You need to buy tablets from the supermarket which contain 800 to 1,000 units, which is the same as 25 micrograms of vitamin D. There are other strengths of vitamin D available, but these are for people who are less likely to have low vitamin D, for pregnant women or for children.
How can I prevent getting low vitamin D in the future and keep my bones healthy?
The most important way to prevent low vitamin D in the future is to take a daily vitamin D supplement. In addition, if you are able, it's a good idea to regularly expose your skin to the sun. You only get a tiny amount of vitamin D from your diet, but for healthy bones it's really important that you get enough calcium in your diet. Foods that contain lots of calcium include sardines and other fish containing small bones, dairy products such as cheese, yogurt, milk and eggs, and dried fruits such as figs and apricots. We know that some people don't like drinking milk, so there are other foods here that you can eat that contain calcium. In addition, there are foods which contain calcium at lower levels which you can include in your diet, such as baked beans, other pulses such as chickpeas and kidney beans seen here, oranges, broccoli and other leafy green vegetables. If you don't think that you've got enough calcium in your diet, please see your doctor as you may need supplements to increase your intake.
Do I need another vitamin D test?
If you are in the red group with very low level of vitamin D, you will need a repeat blood test at 4 months to check your levels have improved. The GP practice will contact you to remind you to book this blood test. Otherwise, you do not need a repeat blood test.